a nurse practitioner here. I'm gonna do a full head to toe assessment on you today. Is that okay?
Yes.
Okay. You let me know if anything's uncomfortable or if we need to take a break or stop at all.
Okay.
So let's start out. Can you tell me your name and birthday?
Amy Smith, 11762.
Okay. Do you know where we're at right now?
Yeah, we're at Research Medical Center.
Okay. What are we doing here?
We're doing a head to toe assessment.
Okay. And what is today?
Today is December 1st. It's Wednesday.
Okay. So my patient is completely alert and oriented. Just on first assessment, she appears to be clean, well dressed, good hygiene. She doesn't appear to be in any visible emotional distress at the moment. So just an overview of her skin. She's Caucasian in ethnicity. Her skin appears to be pink. It's dry. She's warm throughout. Let's see. I note she has a little bit of discoloration with freckles. I can see one right here. It's not raised, it's round in shape, probably 1 millimeter. It's light brown in color, round. It's a macule. Now I'm gonna feel your head, is that okay? Can you tell me if this hurts at all? Anything?
No pain.
Okay. No lumps noted on her head at all, no abnormalities there. Her skin is pink and intact. Her hair is clean, smooth, shiny. It's blonde in color. It doesn't appear to be brittle or breaking. Okay, I'm gonna look at your face a little bit. Can you pull your mask down? Can you smile really big for me? How about your cheeks? Raise your eyebrows. Okay, her facial movements are symmetrical, meaning that her cranial nerve number 5 is intact. I'm gonna put just a little soft here, and you tell me where I'm touching, okay?
Okay. Chin, cheek, right cheek, forehead, left cheek, nose.
Okay. And then I'm just gonna put some pressure here. You tell me if this hurts at all.
No.
Okay. No pain with palpation on her sinuses. Okay, I'm gonna take a look at your eyes now. On assessment, her eyebrows are even and full. Her eyelashes are even and full. Her palpable fissures are even and symmetrical. Her eyelid creases are even and symmetrical. There's no hypoptosis noted. Let's see, I'm gonna pull down just a little bit here. Okay. Her puncta and conjunctiva are intact, pink and moist. Let's see. Now I'm gonna take this and shine a little light just from afar. Okay, I'm looking for the white reflex, meaning that she has ocular alignment. Let's see. Now I'm gonna have you look right up here and follow my finger. Follow my finger. Good. That's testing cranial nerve 4, 5, and 6. And there's no nystagmus or strabismus noted with those movements. Right here. Okay, her pupils are equal, round, and reactive to light. There's no red reflex noted. They're about a size 3 to 4. And they reacted briskly. Let's see. Oh, let me take a look at your retinal background here. Just look right up here. Okay. And her retinal background appears to be intact. Make sure it's still okay. Yeah. Her retinal background is intact. Her retinal vessels are intact. I can visualize her optic discs. Those are both even and symmetrical and intact. She doesn't appear to have any macular degeneration. And the retinal background was light red in color. Let's see, now we're gonna do visual fields by confrontation. Cover the same eye as me, and you tell me which numbers I'm putting in each quadrant.
2, 3, 3,
Okay, and same eye, sorry, and you tell me when you see my finger. Okay, and other eye?
2, 1, 1, 2.
Okay, and tell me when you see my finger.
I see.
Okay. Her visual fields appear to be intact, even, and symmetrical in all fields. Okay. Now I'm gonna take a look at your ears. Just on external assessment, her auricles and external features appear to be intact. There's no scarring or visible deformities. They're even along her head. I will now take a look at the inside. Okay. I'm gonna pull the pinna up and back to assess the canal and tympanic membrane. Okay. The canal is pink and intact. The tympanic membrane is also intact. It's gray in color. There is transparent light reflex. I can visualize the umbo, handle of malleus, and short process, and I will assess the other ear for the same. Okay. Same thing. The ear canal is intact. It's pink. The tympanic membrane is a light gray in color. It's also intact and transparent. The umbo, handle of malleus, and short process are well visualized and intact. Now I'm going to do a whisper test. I'm going to stand behind you and say a couple things, and you repeat back to me what I'm saying.
3, 4, 5.
Okay, and turn your legs this way a little bit.
1, 2, 3.
Perfect. And swing back around. Now we will do the Weber and Renee test. The Weber test, I'm gonna ping this on my elbow and put it in the center of your head, and you tell me if you hear it evenly in both ears, or more on one side.
Even.
Okay. Now for the Renee test, I will do the same, and first I'll put it on your mastoid process. Tell me when you don't hear it, and then I'll move it around to the front, and you tell me when you don't hear it.
Okay. I don't hear it. I don't hear it. I don't hear it. And I don't hear it.
Okay. Those are normal findings because the air conduction was twice as long as the bone conduction. Okay, I'm going to assess your temporal mandibular joint. Go ahead and open your mouth and move your jaw side to side. Good. I don't feel any cracking or popping. That's a normal finding. And your temporal masseter muscle, go ahead and clench your jaw. Good. Even strength on that as well. Now go ahead and turn your head from side to side. Good. Good. Her sternocleidomastoid resistance is strong. And raise your shoulders. Good. And she has a strong shoulder shrug indicating that her cranial nerve number 11 is intact. Now I'm going to feel your lymph nodes. Pre-auricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and supraclavicular. Now I'm going to take a look at your nose. Can you pull your mask down a little bit? Just shine a little light. Okay. Her nares appear patent and intact. I can see her dorsum, ventrum, and tip are in line and symmetrical on external features. And her septum appears intact in midline. Her mucosa is pink, moist, and intact, no abnormal drainage or discharge from her nares. Okay, now I'm gonna look inside your mouth. Can you open your mouth? Okay, and lift your tongue up and down. Good, and move it side to side. Good, and can you swallow for me? I'm gonna feel her thyroid. Take a big swallow. Okay, I feel the isthmus and the lobes are well intact, and her trachea is midline, no tracheal deviation there. Her tongue is strong, indicating her hypoglossal cranial nerve is intact. Her mucous membranes are pink, moist, and intact, no missing teeth. Her buccal mucosa is pink and intact, and no abnormalities there. Okay, you want to put your tongue out? The dorsum and ventrum are intact, no thrush or cracking noted there. Let me take a look at the back of your throat. Say ah, ah, okay, good. Her pharynx is intact, her uvula is present, her tonsils are even in size, no enlargement, redness, swelling, discharge, or tonsil stones noted from those. And you haven't had any pain in your throat, correct?
No.
Okay. You can put your mask back up. Now we're going to assess your lungs. First, I'm just going to palpate a little bit. You tell me if any of this hurts. Pain with palpation. Okay. You say 99.
99.
Good. I note that she has regular, even respirations at rest, no accessory muscle use, or audible wheezing heard. Now I'm going to go ahead and listen to you. And there are even and clear bronchial sounds. Even and clear bronchial vesicular. On the sides here. And even and clear vesicular sounds. Now I'm going to assess your back. Can you spin around so that your back is facing that way? I would also count her rate of respirations for a full minute. For time purposes, I'm not going to do that. So tell me if there's any pain with palpation.
Okay.
No pain there.
Okay.
Okay. Can you say 99?
99. 99. 99. 99.
Okay. We'll do some percussion. Okay. Go ahead and take a deep breath. And out. Okay. Our chest expansion is even and symmetrical. I'm going to find your diaphragm here, so go ahead and take a deep breath. Hold it. Okay, and let it out and hold it. Okay, so her diaphragmatic excursion is about 3 to 5 centimeters, which is a normal finding. Now I'm gonna listen to you. Just read normal. Okay, I heard bronchial vesicular down the middle, and then vesicular on the outsides, outer lung fields. All lung fields are clear, even, no adventitious breath sounds, no wheezing stridor, anything like that found. Okay, we'll assess some costovertebral angle tenderness while we're back here. Let me flip the slide. Okay, tell me if this hurts at all.
No. No.
Okay, you can go ahead and spin around. I'm gonna set this up just a smidge here. Okay, can you lean back for me? So I'm assessing for jugular vein distension. I don't see any. Yes, no jugular vein distension noted. Can you go ahead and sit up? Okay. First I'm gonna feel your carotids, and then your aortic and pulmonic, and tricuspid, and mitral. I don't feel any thrills or heaves in those places. Then I'm gonna listen to all of them. The aortic, pulmonic, tricuspid, and mitral. I would listen to the mitral for 1 full minute. For time purposes, we're not going to do that today. That was with the diaphragm, and I'll also listen to them with the bell. So there's our aortic, pulmonic, tricuspid, and mitral. Okay, S1 and S2 were heard, in all of those places, no S3, S4, or S2 splitting. Can you sit forward for me a little bit? Okay, I will listen to the aortic and pulmonic again. With the diaphragm and with the bell of the stethoscope. Once again, no S1 and S2 were heard, no S3, S4, or S2 splitting. Can you lay on your left side over here? So let me drop this back down for you. I'll now listen to the tricuspid and the mitral. There's the tricuspid and the mitral with the bell and the diaphragm of the stethoscope. And you can sit up. And once again, S1 and S2 were heard, no S3, S4, or splitting. Now I'm going to assess some pulses. I feel the carotid up here. I feel her brachials, radial. Sit back just a little bit. Her femoral, popliteal, posterior tibial, and dorsalis pedis. All of her pulses are 2+ strong, even, and symmetrical on both sides, no bounding noted. Her skin is warm throughout. I don't note any edema anywhere. Her temperature is warm, she's not diaphoretic at all, her skin is dry. I don't know any clubbing in her fingernails. Her calf refill is brisk, it's less than 1 second. Her skin turgor comes back within a second, so it's brisk as well. Okay. Next, we're gonna do your abdomen. Can you lay flat for me? I'm just, initially I look at the shape of her abdomen. It appears flat. Do you have any pain in your abdomen at all?
No.
Okay. I'm gonna go ahead and listen to her abdomen first. I would listen for a full minute in each quadrant for time purposes. I'm not gonna do that today. I do hear active bowel sounds in each quadrant. I'm gonna percuss her abdomen. No dullness noted. I'm then gonna do some light palpation. Does that hurt at all?
No.
Okay. And some deeper palpation. Any pain with any of that?
No.
Okay. I'm then gonna feel her liver and her spleen. Okay, go ahead and take a deep breath. And let it out. Okay, I feel her spleen, it's smooth, I'm sorry, her liver, and it's smooth, just barely runs under my fingers there. That's a normal finding. Go ahead, roll to that side just a little bit. We're gonna assess if her spleen is enlarged. Take a deep breath and let it out. Okay. I do not feel her spleen, which is a normal finding, meaning that it's not enlarged. Lay back, and we can try to feel for kidneys. And no kidneys are felt on assessment today. I'm gonna go ahead and sit up. We're gonna assess some motor strength in your range of motion. Can you move your neck up and down? And side to side? And swivel your head around? Perfect. Can you raise your arms up and down? In front of you and behind you? Good. Can you lift your knee up off the table? That one. And kick your legs straight out. And back, and wiggle your feet up and down. Good. Now we already did some of this, but go ahead and push against my hands a little bit. Good. Good. And push back and forward. Good. When we did those, go ahead and put your arms out, and I'm going to try to push them down. Don't let me. Good. And this way. Good. And go ahead and put your arms like this, and I'm going to try to pull and push. Okay, and lift your legs up. Good, good. And knees out, knees in. Okay, and leg up, leg down, leg up, leg down. Heels up, or toes up rather, and push down. Okay. Her muscle strength is even and symmetrical throughout all of her muscles. She has full range of motion and good muscle strength. Now we're going to do some sensory type things. I'm going to stand up. But first I'm going to assess your spine a little bit. Do you want to bend over for me? Are you able to do that without pain? Okay, good. Perfect. Nice and flexible. Now go ahead and take just a regular walk and come back. Okay, she has appropriate gait. Now we're going to do heel toe. So walk with your heel to your toe, heel to toe. Good. And she's able to do that appropriately. Good, meaning that her cerebellar function is intact. And can you put your arms straight out? Okay, and close your eyes. Good. Okay. We were looking for pronator drift. We don't notice any. She's able to hold her arms up for an extended period of time. We can go ahead and relax them now. So we did the tandem walk. Now we're going to do the Romberg's test. So close your eyes, and we're just going to see if she sways at all. And she does not have any sway. We would do that for at least 30 seconds, maybe 60. So that's a normal finding. Now I'm going to hold my finger out. Can you touch my finger and then touch your nose? And your nose and my finger. Okay, and same with the other side. There we go. Perfect. And can you do this? And back up. Perfect. Now you can go ahead and have a seat. We're going to do some sensory type things. I need to, my phone might die. Making sure that doesn't die there. Please don't die. Okay. So now I'm gonna just assess some sensation type things. I'm gonna rub either a cotton ball or this pen cap, and this will be our sharp, and this is soft. So you feel that one? Okay. So you tell me if it's sharp or soft. Okay. And close your eyes.
Sharp. Soft. Soft. Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Oh, soft, sharp.
There you go. Okay, sorry. So that's all intact. Where's my, this one? Oh! Okay, now I'm gonna do some vibrations along your arm. You tell me that if you can feel them, okay?
Okay. Yes. Yes. Yes.
Okay. Now I'm gonna move my fingers, and you tell me if you feel 2 or 1, okay?
2, 2, 1. 2, 2, 1.
Okay. Good on this side.
2, 2, 1.
Perfect. Now I'm gonna put an object in your hand, and you tell me what it is that you're holding. Okay, grab your hand. Okay. That was stereognosis, and that is intact. Now for graphesthesia, I'm gonna draw a number on your palm, and you tell me which number it is.
Okay. 5. 3.
Yes. And we'll do it on this side.
1.
Yep.
2.
Perfect. And then for the last one here, I'm gonna wiggle your toe either side to side or up and down, and you tell me which it is.
Okay. Side. Up. Side. Down.
Perfect. And then we're just gonna do some reflexes. Okay, first we're gonna do your brachial here. And just relax your arm right there. Good. And we'll do this side. Good. That was her brachial. Now just put your arm like straight out next to you and let it rest in my arm. Good. Her tricep. Good. 2+ reflex in biceps and triceps. Now we'll do brachial radialis. good. Okay, and 2+ for brachioradialis as well. Now we'll do the patellar reflex. 2+ there. Just relax this leg. And 2+ there. And now for ankle reflex. Side. Good. And then we're gonna do a Babinski. That was a 2+ reflex there. Here's your Babinski. We'll do it on this side. And the toes curl, which is a normal finding. And then on her abdomen as well, you wanna lay back just a little bit. I just slide down